My name is Dr. Stanley A. I am an orthopedic surgeon with Dixon Dively, and I've been with the group for 15 years. I practice general orthopedics with kind of subspecialty interests in trauma and lower extremity with a lot of shoulder surgery also. When I was in medical school, I realized I like taking care of injured people. When I would be on rounds in internal medicine and we were just managing numbers and sodiums and stuff, that wasn't as interesting to me. I liked the fact that I could take an individual who was previously active and then injured, and we could bring him back to get back to a lifestyle that he wanted to do. I tend to be a little more on the conservative side when we're coming to deal with orthopedic trauma. The human body can take care of itself pretty well. We can help it along. There's a lot of things that we need to operate on. There's some emergency things, things that are crooked we make straight, but a lot of times just using the judgment of how is the body best able to take care of itself. There's some patients that surgery may not be the best thing for them. They may have other medical problems. They may have high risk of an infection, and having to use the judgment on what to operate and what to not operate on is one of the things that kind of, seeing a lot of patients, you get more comfortable managing things, both conservatively or non-operatively, and surgery. One of the most rewarding things about being an orthopedic surgeon is actually helping people who have had a life-changing event, bring them back and get them back to doing the things they want to do, be it a sporting activity. If someone has been hurt on the job, getting them back to gainful employment, being able to provide for their family. Taking someone who isn't really, like an elderly patient who isn't real mobile and they break their hip, keeping them active. My primary goal for orthopedic treatment or care of the patient who is injured is to get them as close to or equal to their level of activity that they'd had before the accident or injury occurred. Trying to get them to maintain the active and quality of life that they want, not necessarily at the same exact level, but as close to possible as we can, as close to normal as possible.